dads, a very warm welcome to another episode of Today's Parent. I'm your host, Christine Casina. This is something that a lot of you have sent SMSs about. You want us to cover common skin disorders in children. And today, we are lucky to have a specialist, a doctor who's going to do just that. Her name is Dr. Wambui from Empisha Hospital, and we are so happy to have her. And I hope you learned something from this episode. Daktari.
Yes, Christine.
Welcome to today's episode.
Thank you very much.
Today's Parent.
Yes.
I wanted to ask you something, because from your bio, you say that you love working with children. What do you love? What do you love the most about working with children?
I find children are very easy to work with. Children are very genuine. When a child is sick, they will tell you they're sick. When a child is in pain, there's no pretending about it. And once they get better, they have a smile on their face. And children do tend to bounce back. Children are very perseverant, they're very honest. You learn a lot from them, and you learn to appreciate life.
Wow.
So I do get a lot from them and learn a lot from my children.
Right. Dr. Wambui,
Yes.
make me understand, skin disorders in children, is it something that you face a lot with parents?
Yes, it's actually quite common. Skin disorders do occur commonly in children, and there are a variety of them. The thing with skin issues, sometimes when they do occur, the child may be normal, no issues, and the parents are still worried because it's something they can see.
Right.
And then there are some skin conditions that really irritate the child because there's burning, there's itching, the child does not sleep, and also may come with other symptoms such as fever and poor feeding.
Right.
So these are things that concern the parent.
Okay.
Then there are some skin conditions that parents associate with hygiene. So sometimes they may feel a bit ostracized in school. So they'd come with you to you really worried about what exactly this is and how to prevent it.
Right. So let's go through them one by one. If we can classify the different skin disorders, how do we classify them? Fungal, bacterial, parasitic, how do we cluster them?
Okay, so it's easy, as you said, how to classify them. To make it simple is we have the fungal skin conditions, we have bacterial skin conditions, we have viral caused skin conditions, and then we also have some that are just caused by allergies and irritants in the environment, yes.
Okay, so let's start with fungal. And the first one, even before you say it, and the parents at home, I'm sure they've even answered that question already. The first one that comes when you talk about fungal, ringworms.
Yes.
Where do they come from?
Ringworms is quite common. So ringworms are caused by a fungi and can affect any part of the body. So they can affect from the scalp, the hair, what we call tinea capitis. It can affect any part of the body, the skin, so tinea corporis. We also have a common thing, athlete's foot. They're usually very hard to treat, which now affects the interdigit of the toes. And then
in between the toes.
In between the webs of the toes.
Right.
Yes. And then we also have the fungal nail conditions that we get on the nails that cause discoloration and peeling of the nail. So the fungal skin conditions are usually caused by skin-to-skin contact, as well as using garments, combs that have been used by someone who has the infection.
Right.
So when you go to the barber, the salon, what your babies has their hair combed with, what you have in the house, people in households, when one person has the condition, it's very easy to spread to someone else.
Another person.
Yes, if we're sharing beddings or sharing hand cloths and sharing towels that have not been washed, it's very easy to spread the condition.
Right.
Children go to school, they're sharing hats and caps, and I want to wear this, I want to share that.
So that is how it spreads in our school-going children.
Yes. And they're always playing with each other in contact sports. When they go to the swimming pool, they go and use the gym lockers and the swimming pool lockers and the showers, and they're not wearing their sandals or their slippers, so they can get also the fungal skin conditions on their feet. So it's just our environment and just skin-to-skin contact.
Right.
Yes.
So before we move from ringworms, how do we prevent them? How do we treat them?
Okay, so one thing is hygiene. So we just need to tell our children, no sharing of hats, no sharing of combs in school, no combing each other's hair. Sharing of hats, we need to wash our clothes properly. So preferably in some hot water, especially if you know there's someone in the house who has an infection. If there's one person in the house who has an infection, make sure the person is treated to avoid spreading to the rest of the members.
Right.
Kids, when they're at the pool, even as adults, wear some sandals, some slippers in the locker rooms as well, and around the swimming pool.
Okay.
Yeah.
Okay.
So one thing I'd like to mention about ringworms, it has nothing to do with the worms that we talk about in the stomach.
Really?
They're only called ringworms because of the circular pattern that they have. It's a bit raised.
Ah.
Sometimes could be itchy and has a bit of scaling of skin. But that ring really tells everyone, I need to deworm my baby. My baby has been eating dirt. But it's just a fungal condition
Which-
with skin contact.
Daktari, which brings me to a very random question. How often should we deworm our children, and when should we deworm our children, now that you're a pediatrician, by the way?
Yes, so ideally I recommend it from the age of 2 years.
Or from 2?
From 2 years. So this is when children are outdoors, they're playing more outside, they're in play groups and schools as well, and they're always touching and putting things in their mouth. We say every 6 months ideally, yes, so
Okay.
that's recommended.
Okay.
Yes.
So unless there's another fungal infection you want to share, do you want us to move to another category?
Yes, we can move to another category.
So where do we move to?
We can talk about viral
Viral.
skin infections.
Right.
Yes. So I'll talk about the ones that I see and parents come very scared about is measles. So measles is a viral infection. It's self-limiting, so it comes and goes on its own. The worrying thing is this sudden onset of a rash that parents see. So the rash tends to start on the face, going down to the neck and to the rest of the body.
Yeah.
And as it progresses and resolves, it resolves in the same way from the face, the neck to the rest of the body. Associated symptoms with measles may be a running nose, a cough, and watery eyes.
Yeah.
May or may not have a fever, which is usually parents' concern as well. And then you may have a history of a baby went to a party, was in school, and they saw someone with a similar rash as well. Because this virus is spread from droplets. We call them respiratory droplets. So when you're sneezing, when you're coughing, when you're laughing, you leave them on the surface and you spread them from one person to the other. So
Okay.
it's spread from children through that kind of mode.
Right. But then, it begs the question, we emphasize that we should get our children vaccinated, and you work so hard to come to you to get them vaccinated. How do they get it again after all the vaccinations we give them for measles?
So measles has very severe complications. It can cause brain issues, hearing disorders. So with a vaccine, it doesn't not necessarily mean the child will not get the virus, but will get a less severe form of the virus.
Right.
So may not lead to the complications that we hear with measles.
That's good to know.
Yes. So vaccination is still very important.
Okay.
Yes.
There's something we forgot to do under ringworms. How do you treat ringworms? You mentioned about prevention, but we didn't mention about treatment
Okay. So
before
the
we go into treating measles.
So treatment of
For ringworms.
for ringworms is usually antifungals.
Antifungals.
So this, you'll either be given a topical ointment to apply or a cream, depending on where the ringworms are. You may also be given something oral, especially for very severe infections
Okay.
or refractory conditions that are not being managed with the topical ointment on their own. So your pediatrician will probably tell you how and how long. So usually from about 2 to 4 weeks or to 6 weeks of treatment that needs to be followed up just to make sure the issue has resolved.
Right. As you speak, there's a question from Maggie that's coming in through our SMS number 22999. Her question is, my child has had a persistent ringworm that is not going away. What do you do in such a situation?
Okay, first I'd like to reassure mom. It's something that we can deal with. So depending on the site of the infection, so we'll start with our topical ointments. Then after that, we can try some shampoos, especially the one for the scalp. The Tinea capitis tends to be very hard to get rid of.
Okay.
And then probably also just change the combs she's using in the house, sterilize the hats, wash them in some hot water, whatever he's using for the pillowcases and the towels. And then also maybe try a different barber shop for a while and see if that works.
All right. Thanks for those pointers. Let's move back to measles. How do you treat measles?
So measles, being a viral infection, we don't give anything in particular. So no role for any antibiotics here.
Okay.
We just manage the symptoms that the baby has just to make sure baby is comfortable.
Okay.
So if there are fevers, we'll give an analgesics and paracetamol. If there's itching, we can give a topical ointment to apply or some
Right.
calamine lotion. If there's really severe itching, then maybe an antihistamine may have a role to play.
Okay. So let's move to, before we go on our break, other viral, skin disorders, because as per Dr. Google, you have something like herpes and viral skin disorders amongst children as well, because we always assume that it's something that happens in adults only. So it also happens in children.
Yes, we do have warts, and warts are caused by the herpes virus.
What is it, by the way?
So it's the herpes virus, but different variants. We have the variants that cause oral cancer, cervical cancer, and the like. So you have some that cause skin infections and usually cause a kind of hardened kind of pimple, sometimes on the palm, sometimes on the sole, and tends to be very painful. Sometimes may have a small dot on it, and every time you try and apply an ointment, it doesn't go. It's kind of difficult to treat. But once a doctor or a dermatologist is able to have a look at it, they'll automatically know.
Right.
So it's the non-genital warts that actually cause this virus, and it's also still through skin-to-skin contact with probably someone who had the same virus. So your doctor or dermatologist will probably prescribe something just to burn it off until it resolves, and then we're good to go.
All right. So let's talk about, before we go on the break, because I remember my experience when I had it, must have been around class 4. I missed class and I was put out in the sun, covered in white, like in white cream or white powder, chicken pox, the nightmare of many. Where does it come from and what causes it?
So once you mentioned the white, I just remember calamine lotion. Yeah, chicken pox, definitely. So chicken pox is also a viral infection. Yes, so also just the way mumps is spread, so from coughing, sneezing, and the like, so the droplets that we're having in the environment.
Really?
And then also from the vesicles. So chicken pox starts as a small kind of pimple and then develops into a water-filled kind of pimple. So when that bursts, you can now spread it to someone else, and that's why you're isolated for a bit. For some children, they feel nothing, but other children, it can be quite itchy and quite burning in sensation. So the same way that we treat measles, just the symptomatic management being a viral infection. So manage your fevers, manage the pain, manage the discomfort, and your calamine lotion.
And just back to the same, the same topic of chicken pox, the same disorder. The scarring that happens when you have chicken pox, I don't know. Is there any advancement in medicine that makes it possible for the scarring to go away? Have things gotten better, or we still have, the same old practices we used to have way back when?
So scar management is the same. We probably just make sure you oil the baby well. But for most children, with time, just need to be patient. The scars do go away. For most children, those, we call them post-inflammatory markings, they actually do resolve, and you rarely see people with the chicken pox marks later on in life. Yes.
And now that we have a bit of time, before we go on our first break, just if you could mention any complications that could happen, under especially fungal or viral that we've covered so far, what complications would come about if we leave any of these conditions untreated?
For most of them, they usually resolve on their own, and just supportive management is okay. The issue with itching in children, sometimes because their hands are not as clean, they've not probably washed their hands after the toilet, they may scratch too much and introduce infection into their skin. And we'll talk about bacterial infections later. So sometimes this breaks can actually cause bacterial infection to the skin. If it gets too severe, they may have now a systemic infection, meaning whatever bag it was has now entered the bloodstream and will now cause other symptoms of fever, lethargy, and poor feeding. So usually that would be the main complication. With other infections such as measles, thank goodness, due to vaccination, there are less incidences. As I said, you can get some brain infections. So infections of the brain, infections of the covering of the brain as well.
Really?
So, and pneumonias and hearing loss as well. So these are things.
We can actually move from having a skin condition to having pneumonia.
Yes.
Who would have thought?
That's why vaccination is very, very important, and we're very keen on it. And I'd encourage and urge parents, especially when there's viral infections, your measles, your mumps, your chicken pox, need to be vaccinated against.
Right. So let's take a short break, Dr. Ari. Thank you so much for what you've shared so far. Let's take a break, and then when we come back, we continue the conversation. In today's episode, we have the privilege of having Dr. Wambui from Mpisha Hospital sharing with us the common skin disorders that happen in children. We have covered fungal conditions and viral conditions as well. We'll continue our conversation when we come back. Don't go anywhere. Welcome back to today's episode of Today's Parent, where we have Dr. Wambui. We are talking about common skin disorders in children. Dr. Ari, we are back from the break, and it's interesting. Today we have a question from a dad. And Muredi is asking, Mr. Muredi is asking about diaper rash. What causes diaper rash? Do we classify them under skin disorders? What do you think?
Diaper rash is a skin disorder, a very common skin disorder. I think for all children, at some point, they do have a diaper rash. This could be either due to changing diapers. It could be due to not changing diapers frequently. Could be due to a frequent and recent infection, maybe something like diarrhea, so they are going to the toilet more frequently, or a urinary tract infection where they're peeing more frequently.
Right.
So diaper rash is usually caused by a reaction with the stool and the urine with the skin of the baby. I know we don't sometimes people say don't change the diaper until it's full, but it needs to be changed frequently because your stool and the urine has enzymes, it has proteins that do react with the skin and irritate the skin despite applying a diaper kind of ointment. Some diapers may not go with certain children. I would say a certain diaper brand would be okay with my baby and with a
react
different.
with another child.
Everyone's skin is different, everyone is different, and every baby is also different. So it's just finding the one that works for a baby. So sometimes a certain diaper can be affecting the baby, or a frequent passing of stool can affect the baby, or poor changing of the diaper as well.
So what pointers would you share with Mr. Mureithi and any other parent who's watching when it comes to diaper rash? You've mentioned number one, you might need to switch brands here and there and see what works. You've mentioned that.
Yes.
And then when it comes to changing your child, how often should we do that? What is too long? What is changing too frequently?
I'd recommend 3 to 4 hourly because that's more or less the frequency of the feeding of a baby.
Right.
So 3 to 4 hours. Don't wait until the diaper is very full to change the diaper.
Right.
If you have a baby who has maybe diarrhea,
Yeah.
change the diaper every single time the baby poops. And if you can, in between changes, let the baby be free. Let the skin breathe. Try and use a good cream that works for the baby. As I said, also very unique to the baby's skin. Something that's not perfumed, something that's very gentle on the skin.
Okay.
Apply a thin layer. Too thick a layer, I know you feel like you're doing something, but that just ends up sticking onto your diaper. So your diaper doesn't absorb what it's supposed to absorb. It doesn't do what it's supposed to do.
So we shouldn't put too much.
Just a thin layer. Just a thin layer that's rubbed well, and make sure the area is clean.
Okay.
As much as possible, avoid using the wet wipes. Probably when you're going out, because they're perfumed, they're scented. Let's go to natural.
Wow.
Yeah. So let's use our cotton wool and just some clean water. Wipe the area, pat it dry, make sure it's dry. Like any other skin part of ours, we'd like it dry before we cover it up, so you don't have moisture and bacteria flourishing there, as well as irritation.
Okay. So even for older children beyond 6 months, cotton wool is what you'd advise?
Yes. I'd advise
well, this takes us to way back when we are so used to the convenience of wipes, but that's a good pointer.
Yes.
That's
when you're traveling, it's okay, but when you're at home, as much as possible, stick to what is good and healthy for your baby.
All right. Yeah. Going back to the conversation of today, we've done fungal, we've done viral. How about we talk about bacterial? What comes to mind?
So bacterial, a lot of mothers come with babies with these skin conditions that's crusting, especially on the skin, on the face. So it's a bacterial infection that we call impetigo. A big word, but it's just a bacterial infection of the skin. So what tends to happen...
Impetigo.
Yes. So what tends to happen sometimes, we scratch our skin. Remember, skin is a barrier. It protects us from germs from outside. So sometimes we scratch our skin and cause abrasions that, or a mosquito bite, or just insect bites in general, and it breaks the barrier protection of the skin. So we introduce bacteria from the environment as well as from our nails and our hands. And from there, you have a small bump that forms. After a while, it busts into a blister. And then you have a crusting lesion that looks very scary. And I've seen it a lot with children who are having nose issues. So they've been blowing their nose the whole week, and they've been scratching themselves with a tissue. So what tends to happen, they have this all around the mouth and the nose that occurs. Okay. So a bit of crusting of lesions. So it's just a bacterial infection that usually just spreads on the skin.
You know, it's funny you've mentioned about impetigo, because we have Ruth who sent, her question through our SMS number 22999, that she has a newborn and she's noticed her newborn skin is so dry. Is it something that could be impetigo? But of course, we would recommend that she goes to hospital. But just to link it back to that, is it possible for infants to have impetigo?
It is possible, especially if we're changing them and we're using things that are very rough on their skin and causing these abrasions. As I said, the abrasions are what allow the bacteria to actually enter the skin. Okay. So that can actually occur. Okay. Yes, depending on how we do our skincare.
All right. So let's move to the next one, parasitic. As another category, what comes to mind is scabies.
Yes.
Enlighten us on that.
People think scabies is not as common. It's actually quite common. We often misdiagnose it for something else and probably just apply an ointment at home and go. So scabies is a parasitic infection and it's caused by a mite. So this mite is spread from one person to the other through contact as well.
Okay.
A caregiver can spread it to a baby because they're in close proximity, or the baby can actually give the mother
Right.
as well. Direct contact, people who wrestle sports, using towels, same thing, hygiene, the towels, the beddings that we don't wash. Our toys, sometimes we may use toys with each other,
Really?
and some of them have those mites. So it's possible to spread through that.
So we need to clean our toys as well.
We need to clean our toys as well with hot water. Yeah. So what happens? The mite tends to burrow in the skin and causes like a burrowing effect and causes this very, very painful kind of rashes. The common areas are usually the digits of the nails.
Okay.
Yeah, the webs, the
Okay.
finger webs, as well as in between the nails. We can have them on the neck, the waist.
Wow.
And for small children, it can actually affect the palms and the soles as well.
It must be so uncomfortable.
It's very uncomfortable and very itchy. And then if one person in the house has it, most probably will probably spread it to the other people in the house.
Wow.
Yes.
How common is it? Like very common? You know, we used to sit in our home science books and
Yes.
think, this is scabies, and we read about it and it doesn't seem that this is something that can happen
Yeah.
in this particular decade. So it looks like something for way back when. It's very strange that it's back.
It's
Or maybe it's been there and we didn't know.
it probably is, and we've been treating it as something else, but it actually is. Then it's something good that we should look out for.
Okay.
Yes.
Okay. So scabies is what we are covering under parasitic. Is there any other one, or we can leave it there for now?
We can talk about jiggers as well.
Jiggers?
Yeah, jiggers.
Interesting.
Yeah.
Interesting.
For
We've seen a
some-
lot of campaigns around that, by the way.
Yes. I know it's very enjoyable to walk out without shoes, and children also insist
I
on
love
it.
that, by the
Yes,
way.
but we also need to be very careful. Jiggers tend to like nice, warm, moist soil as well as sand. So whenever we're playing in the mud and you have your children in the mud as well, or at the beaches, it's very important to watch out for it. So it will just usually be a skin infection. It doesn't jump too high, so usually will just be around the foot.
Right.
But if we're also playing with sand in the sand castles and the like, we need to be aware of it because it can also come onto our hands as well.
Okay.
Very painful. Sometimes need to be removed surgically, but there are also ointments that are used to apply on it.
Okay.
Yes.
Okay. But I've not heard anybody, within the town kind of setting, getting jiggers. Have you ever seen it's more of a village kind of condition?
It's more in the village, although I know it is in tropical Africa, but yes, it's
Okay.
more in the village, so it may be in certain areas and other
Okay.
places it's not.
Okay.
Yes.
So let's just talk about generally Daktari, because going through all the conditions one by one may be tricky in terms of time. But I think across all of them, the one thing that that comes to mind is there's a lot of itching that happens, and you have this itch that is going on in a child, and we want to tell the child, don't itch, but there has to be a way at home we can manage the itching before we come and see you. What can we do?
First thing, nails need to be short. Yeah. Fingernails have to be short, especially for children. If you see, that's when they have the scratch marks and everything. So fingernails need to be short.
Yeah.
We need to practice good hand hygiene. Teach our babies how to wash with soap and water.
And how should we do that?
So before eating, after the toilet, after playing. So they need to wash with soap and water for at least 20 seconds. Teach them how to wash in between their finger webs. Teach them how to wash in between their nails and their thumbs as well.
Yeah.
So there are techniques you can do. Make it a fun activity for them to do so they can do
Right.
it frequently. Use a tissue for blowing their nose. Throw it in the bin. Wash your hands.
Yeah.
After the toilet, wash your hands as well. Yeah.
Okay.
And then our antihistamines, and just applying for very itchy conditions. You can use some cool water, either give a lukewarm bath, or you can use a cool cloth and just apply on the skin just to give it a cooling effect before you come and see us.
Okay. Any of these disorders that causes blistering, do we have any?
Yes, you do have the impetigo that causes a blister before it ruptures to form the crust.
Oh, wow.
Then we have the chicken pox that causes a vesicle, which is still a blister with some fluid that also bursts out as well.
All right, let's talk about my favorite, chicken pox. How do you manage at home?
So managing at home, still the cool baths. Some have some oatmeal that you can buy at a pharmacy as well, just to help soothe that as well.
Okay.
For the smaller babies, sometimes we put the mittens as well to
And
help
they're
with
really
the
trying
itching.
to get them off, you
Yes,
know?
but always have some paracetamol in the house, whatever your preference is,
Yeah.
to help with any fevers and also discomfort and to help them sleep as well.
Okay. Daktari, before we let you go, just pointers you can share with our parents who are watching when it comes to, from the perspective of a pediatrician and having worked with children for a very long time. Skin disorders, what do we need to know? Just general pointers, helpful pointers, how we can prevent them, where we can do better. If there's anything you can share, you can do that at this point.
Okay, so I'd promote a lot of skin hygiene. So daily washing, using a clean towel, making sure you pat the baby dry after baths, avoiding a lot of moisture.
Let's go back. What is patting a baby dry compared to wiping the baby?
Okay, so this is not a souping kind of motion that we do, because you know it causes also a bit of abrasions on the skin. So just
Right.
patting gently and making sure the baby's skin is nice and dry. A bit of moisture is okay, and then applying an emollient, so either your cream or your lotion to the baby's skin to avoid excessive drying. We say sometimes leave a bit of moisture just to be able to trap it in when you apply your lotion, so we avoid dry skin.
Okay.
So regular baths and regular moisturizing, a simple routine is sufficient for baby.
Okay. Okay. I'm sure their parents who are watching and they want to connect with you in one way or another. How can they do that if they want to reach out?
Okay, so they can either get me through you or they can find me at Mpisha Hospital.
Okay.
Yes.
Thank you so much for coming to share, Daktari.
Thank you, Christine.
Thank you for your time. And with that, we come to the end of another informative episode of Today's Parent. I hope you've learned something. Common skin disorders is something we wanted to learn for a very long time. And just like me, I know you've learned something as well. Thank you so much for watching. I have been your host, Christine Kasina, and we've been here in studio hosted at Little Cribs, where you come to if you're looking for fun, beautiful kids furniture. This is where you come to, and you can also look for them online. Looking for parenting resources, go to www.supermamas.co.ke. Have a wonderful day and see you in another episode.